Dear friends, today we will discuss the opportunistic fungal infections in COVID-19 pandemic. Here I'm going to share some slides and will explain the problem of fungal infections in the pandemic. So why do we need to be wary about opportunistic fungal infections in COVID-19 pandemic? First, there are two reasons why there is opportunistic fungal infection. The name itself is opportunistic because these infections that can be fungus or any bacteria can start in a SARS-CoV-2 infection. The problem in the SARS-CoV-2 or the SARS virus infection in the pandemic in COVID-19 is by the virus, some changes takes place in our immunity. First, there are two situations where we have the virus overwhelming our immunity reactions, and in another, our immune reaction is responding to the virus infection and controlling the virus infection. So the earlier part, the first part, or first type of infection occurs in about 20% of the SARS-CoV virus infections. And the latter one, that is where our body immunity responds and controls the infection, occurs in about 80% of the infections. Now, in the starting of the infection, we find the SARS-CoV virus entering the nose. And out of the SARS viruses till now, this Middle East uh, severe respiratory syndrome virus, and another one is SARS-CoV that happened in 2003, in starting from China. So those are the episodes where we have seen some epidemics. And out of this, the pandemic which is occurring now, it is affecting the nose first. So the disease is first diagnosed from nose infections. Okay. So next, the two situations are there. The first one you can see in the upper part here. In a mild disease, you'll find the immune cells responding to the infection and controlling the infection on our own. Here you'll find the neutrophils to be increasing in its number. That is, neutrophils, leukocytosis are there, but you'll find the lymph tissues, the immune tissues, mononuclear lymphatics, lymphoid tissues, they are decreasing and they're responding to the virus. Now, in the situation where there is a very severe form of disease, which where the patient needs to be admitted in the hospital or to be under the critical care and using oxygenation and ventilation, there you'll find the neutrophils to be immature and they are now reducing in number, they are being overwhelmed, and you can find all the other immune cells are being destroyed. So, this is about the immune complex and the immune suppression that occurs in case of the COVID virus infection, where in a very critical and a severe form, that is about 20% of the incidences, we have this problem. And usually, these opportunistic infections occurs after those patients who needed intensive care unit admission and treatment with ventilator, and those who are needing prolonged oxygen therapy in the hospitalization, along with steroid and immune suppressant medications. Now, another thing is the extrapulmonary manifestations. Here, you'll find in the endocrine system there is hyperglycemia, there is increased blood sugar in the patient with COVID virus, COVID-19. Now another one is the diabetic ketoacidosis. That means there is increase in the blood sugar concentration, blood sugar level. So it also, uh, to some extent, helps the opportunistic infection. Now, let us talk about mucormycosis now. That's the black fungus that we have been talking about in the media and also in the newspaper. People are very much, afraid of having this black fungus. Now, what is it? For that matter, there are white fungus also and a different type of fungi that takes the opportunity of the reduced host immune status and also increase blood sugar. So first it is inhaled through the nose. Okay, so this fungus, they are flying in the air, in the atmosphere, and they are being inhaled. And it infects the sinuses and the nose. Then the particular form that we are seeing in the mucormycosis, that is the black fungus disease, is the rhino-orbital cerebral, that is the nose, eye, and the brain problem. So this disease starts around the nose and in and around the nose. And from there, first the fungus is supposed to be taken care of by the mononuclear cells and polymorphonuclear cells in our blood. And sometimes they are overwhelmed because of the depressed immune status in these patients, and also the hyperglycemic state also increases this immune compromise status. So, what are the symptoms and the signs? In the early stages, you'll find a nose blocked with some runny nose and starting of fever. This usually occurs, say, after coming back from the hospital, or maybe some more than 3 to 4 weeks after the treatment in intensive care unit, or after being discharged, being proved to be COVID negative, and going back home after critical therapy in hospital. And that is the time when it starts. There is swelling and pain in and around the nose, cheek, and around the eyes, bloody black nasal discharge, one-sided headache and facial pain, blurring of vision, double vision, swelling and congestion of the eyes, black ulcers in the mouth, palate, nasal vestibule, around eyes, then mental confusion, loss of vision, and increasing pain in the face, and the appearance of the skin lesions on the face. Now, diagnosis. How to diagnose? Diagnosis is by nasal swab culture for fungus. At the same time, any nasal discharge has to be cultured for fungus. Then biopsy of the swellings or lesions inside the nasal cavities, or maybe in the skin, in the throat, or maybe around the eyes. And this has to be uh, observed under microscopy, and we are giving you a picture of the fungal hyphae in the electron microscopy here. So this is the way which has to be diagnosed. Now the risk factors are diabetes and immunodeficiency, and that these two things occurs in the COVID pandemic, especially those patients whose immunity or immune status is overwhelmed by this disease. This usually appears 10 to 14 days after hospitalization when SARS-CoV-2 infection has subsided, and the mortality rate is very high, about 40 to 80%. So the best way is to prevent by early aggressive treatment and managing with a strong sense of suspicion in all critically ill COVID-19 patients. Now the treatment of choice is amphotericin B injection, and the course is about 4 to 6 weeks. And another is debridement of the lesions with endoscopic sinus surgery to facilitate drainage and debridement. Now there is a evidence-based advisory in the time of COVID-19, which is being published by ICMR, and I'll try to explain some basic points. There are do's and don'ts. Do's are, you have to control the hyperglycemia. This is for the clinicians, and also the patient has to be informed regarding this problem. Like hyperglycemia has to be controlled, blood sugar has to be monitored in the post COVID-19 discharge, and also in the diabetics. Use of steroid has to be done judiciously, correct timing, correct dose, and duration. And usually, it should not be given more than 10 days if at all it is very much necessary. Use clean, sterile water for humidifiers during oxygen therapy, and use antibiotics and antifungals judiciously. These are the do's. Then don'ts are: do not miss warning signs and symptoms. Do not consider all the cases with blocked nose as cases of bacterial sinusitis, particularly in the context of immunosuppression and or COVID-19 patients on immunomodulators. Do not hesitate to seek aggressive investigations as appropriate, like say potassium hydroxide staining and microscopy culture, and for detecting fungal etiology, different types of tests, which are usually done micro in the micro department. Okay, microbiology department. Do not lose crucial time to initiate treatment of mycosis. And if you are a doctor or a clinician, and if you are not very much acquainted with the problem, then you should refer it to the proper area of treatment, proper expertise. And how to prevent is: use masks if you are visiting dusty construction sites. Wear shoes, long trousers, long sleeved shirts, and gloves while handling soil like gardening, moss, or manure. And maintain personal hygiene, including thorough scrub bath. Now, especially for the patient information, use of masks has been stressed by World Health Organization, our government, and any health workers in the particular areas in different states. But the proper use of masks is very much important. We have different types of masks here being shown as N95, which is being used by medical professionals, then surgical masks. Both of them cover about 95% uh, filtration of the viruses, but the bacteria, dust, and the pollen are 100% removed in N95, but in the surgical masks, about 80% only are being removed. Then we also have FFP1 masks, which is used specially for in regards to pollution. It's mainly masks for pollution. Now we have the activate carbon, which more or less looks like the surgical mask but black in color, which removes only 10% of the virus. Then the cloth mask and the sponge mask, which are being used very fashionably by our youths and also different persons in the society, they don't remove the virus. Almost 0% removal is there for the virus. So ideally, for everyone, you have to use a surgical mask and cover with a cloth mask. A cloth mask can be washed every day. You can give 3, 4 masks and you can use one after the other. Then surgical masks has to be thrown away after single use. And they are very cheap also, about 5 to 10 rupees only. Nowadays, even below 5 rupees, you can get it. And these are very much effective. And this is mainly for the general public. Kindly use a surgical mask covered by a cloth mask. So here I'm stopping the sharing of my slides, and this much I'm sharing for today. And this is mainly for the patient information and also for our clinicians who are practicing in their own chambers or maybe in the hospital, in a periphery hospital. The best treatment will be in the tertiary hospitals, and the patient has to be referred to those areas if you have got a strong sense of suspicion. Now, another thing is a team of doctors will be taking care of such patients. There will be ENT specialists, neurosurgeons, microbiologists, and also the physicians. Thank you very much for listening. Thank you very much.